So we'll wait for a few minutes so that a few people
Yeah,
can join and then we can start.
that's fine.
Okay, so we'll start and we'll let people join in as they wish to. So, welcome to
Yeah.
Center Stage, Dr. Rekha. Thank you so much for being here today with us. And for the viewers, I would like to tell that Dr. Rekha Thakur is an obstetrician and a gynecologist at Wellstar Clinic. Uh, and I would let you please, talk about yourself a bit with everyone.
Right. Hello, Richa. Thank you so very much for giving me this time and opportunity to be here. Thank you. And to all the members, hello. I'm Dr. Rekha Thakur, and I'm an obstetrician and a gynecologist with 19 years of experience, and I'm practicing in Gurgaon for last 12 years. I have my own clinic by name Wellstar Clinic and Diagnostic, and my clinic is in Sector 57, Gurgaon, in the Bestech Mall. So it's a multi-speciality clinic where we take care of consultations. I have a team of doctors, and we do ultrasound, X-ray, ECG, and a complete diagnostic setup as well. So it's like a polyclinic. We take care of all first aids and vaccinations and consultations. And primarily because I'm a gynecologist, so we take care of pregnancy through and through. For 9 months, we see the expecting couples in the clinic itself, and for delivery, I am associated with all the corporate hospitals of Gurgaon. So I'm attached with Artemis, I'm attached with Pratiksha Hospital, with Cloud9, CK Birla, Max Hospital. So I give an open choice to the clients, whichever hospital they prefer, they select, they choose, and my team, we go there and we deliver them there. So the mom, the couple, they remain under my care. I will deliver them, I will operate on them. That whole treatment is mine, but the hospital is of their choice, whichever is in their corporate policy or the insurance or which is close to their house. So they select the hospital, and I take care of the delivery part. And again, the post delivery, we take care of the couples in the clinic again. So I'm attached to all the corporate hospitals in Gurgaon for any kind of procedures or operations, surgeries. So I perform these surgeries in the hospitals. And besides this, I also do a lot of antenatal classes. Earlier, I used to do it in the clinic, but now because of lockdown, I'm doing online consultations and online antenatal classes where we educate the couples about pregnancy, delivery, and childbirth process, how to take care of the baby, breastfeeding. So it's a complete educational sessions we do keep having,
Okay,
right?
that's
So now you want to know more about it, anything else, let me know.
So that's wonderful, Dr. Rekha. Thank you so much for your introduction. So for our
Thank you.
viewers, we just because MindSpring is a multi-speciality alternate healing and research center wherein we provide coaching, hypnotherapy, counseling, and
Right.
another objective is to encourage people for holistic wellness, which includes wellness of the body, mind, as well as soul. And we thought that it was important in these during these COVID times, that we also have participation or sessions from doctors like you who can talk about certain important, health related challenges as well as pregnancy related challenges which people are suffering from during this coronavirus time. So, thank you so much for joining. And I have prepared some questions which I thought would be useful to discuss with you, Dr. Rekha. So, the first question that I have for you is, what does coronavirus mean for expecting parents?
Uh, Coronavirus, as such, what it means to all of us is it's a dreadful alien that has come up whom we cannot see, but it is affecting all our lives. So it is something which is very difficult for us to accept, and it is changing our lives. We cannot see, so we find it more dreadful and more frightful. But we
Hmm.
need to change our life and get into a mode of a new normal. That we all have to. Now, talking to expect about expecting moms, yes, they are going through a lot more than a normal human being or all of us. So for them it means it's even more frightful, and they are scared much more than us, because they have to go through a major life changing event, that's a childbirth process. So that pregnancy and childbirth itself is a major event of their life, which they always wanted to go very smooth and happy and nice. Even it should be, it's a life changing moment, and it's a great event. But for because of this virus which is affecting their life, they're a little scared, so all that excitement has gone away, and that excitement has taken place, has been changed to fear, anxiety, apprehension, and they don't know how to handle that moment when
Hmm.
it comes to them. क्या होगा, हॉस्पिटल जाएंगे कैसे होगा, will I be safe, will the baby be safe? So it is, coronavirus has just given them a lot of fear, anxiety, apprehension. They just don't know what to do. So that is
Yeah,
what it means to them. It has come like a challenge to them. Now what,
yeah.
and how do we overcome this challenge? Yeah. So
So, if we talk about the baby, when the baby is in the womb, what does it
yeah.
mean for that baby? How is, is the baby at any kind of threat because of this virus? Can it affect the baby? For example, if there is a pregnant woman and the virus attacks her, then in that case, what will happen to the baby? These are some of the questions, that it
Yeah,
would be
right.
very useful to get an answer from you.
The virus means nothing to the baby. The baby
Okay.
is unknown. So the baby is not in contact with the virus, or the virus does not affect the baby till the time the baby is in the womb. So the baby is quite safe if the mother is not positive, if the mother has no exposure to virus, and even if the mother has exposure, the baby, till the time the baby is inside the womb, the baby is safe. There is no transplacental transmission of virus, and the fluid is not affected, so the baby is absolutely
Okay.
safe till the time the delivery doesn't happen. Now, post delivery, the baby may be exposed to the virus because of handling of the baby, by an infected person. So if the baby comes in contact with an infected person, or if the mother is infected, or the healthcare worker is infected, anybody around in the hospital, if the baby comes in contact with a person, the baby will get infected. There the baby is at high risk of getting infected, because the babies are just a newborn baby, the immunity levels are weak there, so the baby is at higher risk. But till the time the baby is inside the womb, there is no danger to the baby, or the baby, mother should not be scared of.
Okay. So, what does it mean if, the baby has just taken birth and the baby is on the mother's feed? So, and the
Yeah,
mother
so what
is
happens is,
coronavirus positive.
if the mother is negative, then nothing to worry. Now presently, all the hospitals, it has become mandatory to test for the COVID test for all the mothers who are going for labor and childbirth. So obviously, the mother is tested, and the status whether it's positive or negative. Now, if the mother is negative, then absolutely there's no fear, and the mother and the baby can be treated as very normal, and they can go ahead with the care and the breastfeeding. Everything remains normal.
Hmm.
But if the mother is positive, then there are a lot of precautions, and there are a lot of things that changes and that needs to be taken care of. So then the bigger question comes is, should you let the baby be with the mother, or should you keep them in isolation, so that's a
Hmm.
big question, and no healthcare provider or no doctor can decide this for them. It's the mother and the father who has to decide whether they want the baby with them, or they are okay if the baby is kept in isolation and away from the mother. So it is their decision. And but yes, medically we do recommend that yes, they should be kept separate, right?
Okay.
So that the impact is less. Now, if the mother is, the second question is about breastfeeding.
Hmm.
Should we
Yes.
do breastfeeding or should we not do breastfeeding, allow for breastfeeding? So again, this is a decision of the mother itself, what she wants and how she likes it. So if she is still very adamant on no, I will feed the baby, then she has to take all precautions, wear a mask, clean the area, breast, nipples, and then feed the baby. If the mother is okay with keeping the baby away from her, then she needs to take help of a third person, any family member, a support person, or it can be a hospital nurse or a team. So they will express the milk out with all precautions, and they'll clean the area and then express the milk in a very sanitized way and sterilized container, everything, and then go and feed the baby. So any third person will take charge of feeding the baby with an expressed milk and not bringing the baby in direct contact with the mother. So these are two ways how we can handle breastfeeding in a COVID positive mother. So the choice has to be mother's, whether she wants to feed directly or if she's okay with you know expressing the milk and giving it to someone else to feed the baby.
Okay. So, since we are discussing about pregnancy at the moment, so can couples who are trying to conceive, okay,
Yeah.
they are undergoing some kind of fertility treatment to conceive, should they continue with their treatment or should they stop at the moment? What should they do?
Now, again, this is a very personal question, and the decision again has to be the couple themselves. It's a very personalized question, and why is um, uh, there is no medical reason why we can say that do not go ahead with your infertility treatment, or do not go ahead with the treatment and you should wait. There's no medical reason to say that this is not the time to conceive. No, we really don't have any authentic reason for that. It is now, why would anyone defer this plan of conceiving is because of few challenges that may face in case they conceive. So the fear they have is, in what if I conceive now, how will I manage? So the challenges they will face are, one is going for frequent prenatal visit to the doctor, which will become little difficult and challenging because the doctor everything is going online these days, so they will have to depend on online consultations. Getting
Hmm.
an ultrasound and the ultrasound appointments and getting a scan done is little difficult nowadays because the appointments are not available. We are trying to keep a distancing, appointments are not given. So the getting an ultrasound appointment is a challenge,
Hmm.
and hospital visits are challenging. Getting a blood test done means that you are getting yourself exposed to the other person. So for
Hmm.
these practical reasons, you may choose to defer your plan and say that okay, I can wait for some more months and then plan. But for a couple who has been trying for many years, and now if this is a golden time when they have a relaxed free life and they're at home, when the couples are sitting home, and this is the time they feel like it's a bonus time when they're less of stress and they're having a they can plan. So why not, it's a good time for them to take action and go ahead and plan their pregnancy. So the difference is, for couples who are newly married and who can afford to buy some time, they can defer it because the challenges are many. But for a
Hmm.
couple who have been struggling for years, I think they should not defer it, and they should take it as a golden time when you are, under lockdown at home with your couple together sitting and have. So they should try rather than there are very many IVF people have conceived during this lockdown because of less of stress and the good time that they are spending. So it's different for different people.
Right, right. So,
Yeah.
what is your advice about the precautions which expecting couples can take at home?
The precautions.
Yeah, what all
Uh,
precautions should they take while they are at home?
Yeah, so for expecting couple, the precautions against this corona infection, it remains the same as any other individual that we all are practicing and following. So it remains the same, washing hands frequently and wearing mask if you're meeting other people. She can't be wearing mask at home, definitely not, but whenever she moves out and in fact, going out is prohibited for her. She is not, should not be going in public area. All if she
Yeah.
gets bored at home, she can go for a car drive and come back rather than entering any public area. But the precautions at home basically is I want to highlight few points here.
Mm,
If somebody is coming home from outside, or if somebody is going for a grocery and coming home, if the partner, the husband goes out and comes back home, then she has to keep a distance from her and see that he takes bath, he changes his clothes, he washes his hands,
mm,
he leaves all his wallet and car keys and the bags, everything outside the bedroom, and leave it in the living room for a day 24 hours, and then you even touch them, sanitize
mm,
the hands. So then he takes complete sanitize himself, and then he enters the mother's room. So these are small precaution that she'll have to take. See that she doesn't open the door when there's an unknown person who comes in, and if she opening the door, then she should keep a distance from the person, the vendors or anybody who's coming home, and she opens the door, then she should keep a distance, because at that time she's not wearing a mask. So these are
mm,
small precautions. Any grocery or vegetables that comes home, I would
mm,
prefer that someone else will wash those vegetables and then bring in. And if she is taking care of those, then again she should wear a mask and wash the hands and properly then take care of the vegetables and clean them nicely and then bring them inside. And
mm,
so these are small precautions that she should take. And again, when they go to hospital or they are visiting any doctors, so there are few precautions again there they have to maintain. See that there's less of a paper exchange, and they're sitting at a
mm,
distance from the anybody, the be the staff there or the nurses or the doctors. Still you maintain your distance, and do not exchange papers and pens and all those. Try more of a paperless
mm,
discussions. And I think these are small things that we really need to see. We should not carry purse and leave the purse here and there, because the infection will come through objects. We can hold our hand like this, but the moment we touch the surfaces, we
right.
are exposed to that. So she has to see that she again come home and change the clothes, and put the clothes in wash, and keep all
Mm,
the purses outside, leave it in the living room, and not carry all everything to the bedroom. So these are few precautions that she has to maintain.
mm,
And again, there's a very soft corner. There's a weak point here when we talk of expecting couples close to delivery. We allow the family members thinking that they are of a great support. I need family support. So the visitor, the families, they come move from some other city and they come home. So you have to take precaution there. Either you call them 14 days or 2 weeks prior to childbirth,
yeah,
so that they spend 14 days in a different room and then they are through with that, incubation
absolutely.
period, and
Yes.
not call them right on the day of delivery where they travel and they come and they bring in
Mm,
some kind of infection. So you need to plan your things such that if you are calling anybody, be it a maid or a family member, call them 14 days prior to your date of delivery,
yeah.
not immediately on that day. And if
Mm,
you can avoid, that's the best thing. And no visitors. I've seen even now, soon after delivery, there are a lot of visitors who come in to see the baby. I know it is very soft moment where you want everyone to see the baby and appreciate, but this is not the time. It's a peak of infection, so you
yeah.
should
In fact, it's very
avoid.
risky.
It is risky, but the visitors also don't understand. They welcome themselves कि हम आ रहे हैं, and that's very difficult. But the parent also have to understand to say no, because this is very critical moment. So you can't
Mm,
let the visitors or even the close relatives come in and see the baby.
With all the digital transformation that has happened, my suggestion is that people can do a video conferencing and show the baby to everybody in the family, even
Yes,
extended family, who are not
extended
here or
family.
close by. Why to visit?
Yeah, exactly. Why to visit? That's a big question, and we should take help of all the digital platforms where you can connect. But the other thing is, even it's a very sensitive issue when the parents or grandparents they talk over phone. They make the mom even more emotionally
Hmm.
weak. They start saying, "Oh, हम आते, हम नहीं देख पा रहे, ये क्या problem है?" The mother again morally she moves down, rather than feeling happy and that joy and this thing all disappears and then she feels down. So it's also about the conversation they make over the phone and the camera. It's difficult, they pull the whole excitement down, so that should not happen. It's very important. I wanted to share this with the public that this should not happen. When you talk over phone, yes, at least encourage the mom and give her the happy moment and the happy feel, and not pull down the excitement.
Yeah. And in fact, it is equally risky for even the visitors. If they are
Yes, it
suppose
is.
senior citizens, I think it's very risky for senior citizens also to travel even, I think, half an hour and then come over and see the baby. So
It
they
is
also
risky.
get exposed.
Yeah, it is risky for them as well, but they go by their inner feelings कि नहीं हमें तो जाना चाहिए. The culture, the custom stands like a fixed line, but we need to change. Yeah.
Yeah. Okay, so what all are the things for which, pregnant mothers, they do not have to really visit a doctor? Because अभी तक कुछ छोटा मोटा भी प्रॉब्लम होती थी, people just used to rush to their
Yeah,
gynac
they
कि हमें ये हो रहा है, हमें वो हो रहा है. So what all are the things, for which they can just skip these visits or even their prenatal visits and they can take care of at home?
Right. So, especially moms who are in the second trimester, that between 20 weeks till I think 30 to 34 weeks, they can really skip one or two antenatal visits. My advice will be that what I have advised to my clients, my expecting moms are to buy a BP machine at home, to
Okay.
buy a weighing machine, to have these two things at home, and to weigh every 2 weeks. They should check their blood pressure, they should check their weight, maintain a chart of it, and then they should see that they are in the BP is always normal and the weight is increasing gradually. So these two parameters will assure that the things are going fine. Besides this, the third important thing is to keep a check on the baby movement count. If the baby is moving adequately and the baby is moving fine, if they can appreciate at least 10 to 12 movements in a day, then this is a really reassuring factor that the things are going fine. Besides this, they should be in constant touch with the doctor over the phone or online medium, or have an online consultation. And if there is any new sign or any new complaint, any new problem that they are facing, they can talk to the consultant over online platforms. And if they insist her on coming, then she can go and visit the doctor. Otherwise, if there is no other new symptoms or no problems and it is only about the weight, BP and fetal movement, she can sit at home for 2 months or 2.5 3 months, and that's fine. After 2 months she will definitely need an ultrasound to check the baby's development. So for at least for 2 months she can sit at home. With 2 months of gap between two ultrasounds is quite okay, and she can be at home maintaining her weight gain and BP and this baby movement count.
Okay. Okay, so my next question is that what if an expecting mother starts showing symptoms of coronavirus, say in her third trimester, she suddenly starts showing symptoms of coronavirus. So then what should be done in that case? What will be
Uh,
the procedure like? What steps they need
if
to
she
follow?
feels like she is having any symptom of coronavirus, that means either she has cold, cough, or a bad throat or fever, anything. The first thing for me, my advice would be to stay home and not to panic. You know, This can be just like any other virus, cold cough, and it will go away. If her immunity is good, she will just fight it out. Really, do not panic if the symptoms are mild and it's manageable at home. Yes, the normal precautions are to be in isolation, not to get involved with other people, so that to save, keep the other people safe is important. Plus, she can always ask for a COVID testing to be done. Once she consult a doctor, get a prescription made, and then with the prescription, she can order for a COVID test, which will be done by the labs. All the private labs are working. So get a test done, and till the symptoms are manageable, it is good for her to manage at home, right? With this, she should also start some of the immune boosters. I think every expecting mom should start herself on immune boosters like vitamin C, lot of fresh fruits, juices, and green vegetables, lot of vitamin C, vitamin B12. So these are this will keep their immunity high, and keeping herself really hydrated, drinking warm water till the time the symptoms are manageable. I think she should be at home. She may just get over it. Only if she starts very high fever, things are not manageable, she finds it very difficult, then she should reach out to hospital, and she will be taken care of there.
So the first consultation, suppose she starts having symptoms, some symptoms, slight cold, cough, and
Yeah,
feverish she's feeling. So the first consultation, can it be done over call? Can she just
it is
call?
done over call. No, 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 it is
Okay,
done over
she
the
doesn't
call.
need to.
No, no, not at all. If she says, she can just go to her own gynecologist and say, I have these fever, sore throat, bad pain, and we can always write a COVID testing depending on her symptoms. That's absolutely fine. She need not go to a hospital just to get a cold and cough checked. No. So we can give her a prescription and she can get a test done.
And this COVID test, can it be done at home? I mean, can people come and collect the sample or they
They
have to
take
visit a
samples from
hospital?
home. No, 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 no. The lab people, we have to pre-book for the test. There is
Okay.
little difficult these days because the labs, they are overloaded with samples, and the
Hmm.
appointments एक दो दिन के बाद की मिलती है. But she can always book an slot for herself over online this thing, and she will be given a date and time when the boy will come home and take the sample, so she can get the
Okay.
sample done from home. She need not go anywhere.
Okay. All right. So now if we talk about the delivery experience, okay, so how is COVID-19 likely to affect a mother's labor and delivery experience if she does not have coronavirus?
If she doesn't have coronavirus, then the labor process, and even if she has, doesn't matter. Irrespective of what her corona status is, her labor process, the childbirth process, everything remains the same.
Okay.
There's absolutely no difference, and there's no change in that process of labor, delivery, or cesarean section. Everything remains the same. But when we talk of experience, the overall experience is little different because of the scenario. The things which are more of you 4 5 people coming and making the moment very enjoyable, talking to you, encouraging you, so all those things doesn't happen, so you feel like an isolated in one place, no visitors coming, no family members coming. So uh, so from that point of view, you feel little low. Otherwise,
Hmm.
the labor process, the childbirth, the healthcare team, from there, everything remains the same. Nothing changes. The
Okay.
only if the mother is positive, then there are a lot of precautions taken, lot of protocols are followed, the lot of complete, PPE, the gears will be taken, there are less of people. So the whole protocol of working style will change, the process remains the same. And for the mother, the experience, if she's positive, is little different because the people's approach, the way of handling, the way of doing will differ a little bit, slight 5 10% differ. But for a negative mom, I think everything, the process of the hospital remains the same. And once we know that the mother is negative, all the hospital team is happy and normal and fine, they feel she's negative, so she is treated as a normal person, right?
Hmm.
So there is not much of a difference. The experience changes because of the external factors. There the mom goes in a little bit of anxiety ki, "Arey, this is a happy moment, but I don't have people around me to enjoy, to celebrate, to feel happy about it." So, and lack of support from the family side is missing, not the healthcare team. Healthcare side, she gets all the support and care. They get very good care. I've been delivering cases in last 2 3 months. So the medical care, the healthcare team, everything is good and perfect. It's the care and support from the family side is missing. So that's where they feel little low. Otherwise, it's wonderful. It's fine.
Okay. And what are your suggestions for postpartum care? So, like usually grandparents and some other person comes or they have a maid, but because of coronavirus, they may not be able to travel right now. So, what are some specific, suggestions regarding the post-delivery care that the people can take care of at home?
Yeah, postpartum care is itself a very big, topic, and a very big phase, postpartum phase, which includes care of the mother, the care of the baby, the
Hmm.
care of the household, and there's a lot more, the care of the father himself. So there's a lot of things in the postpartum phase that goes on. The couple, they go through postpartum blues and then postpartum depression. So the a lot of things are very very important, and this phase is very critical and crucial. But now, because of the lack of support, the couples are struggling during this phase. But the only thing that can help them is being prepared for that phase, where we, during the antenatal classes, we tell them what exactly will come your way once you bring the baby home. So how the things will be, we give them a preview of the every action, every event that's going to take place, and how you should cope up, how you should share your responsibility. We train the father how to take care of the baby, how to wrap, how to change diaper. So once the father is trained, then he knows exactly how to share the responsibility of the mother, how to help the mother overcome her blues and anxiety and fear. So we really train the husband, and that's very important, because he becomes an important person in that
Yeah.
postpartum phase, to give support to the mother and also take care of the baby, also take care of the household, and so for
Hmm.
everything. So and especially in this lockdown phase, the for the couple, it is important for them to learn and educate themselves about the postpartum events and actions, and their action points, their role as a parent, what they are supposed to do and how they are supposed to do. So that's where I
Hmm.
think online classes I have started because of this only, and where we trying to educate the couples. Even now, I have been doing classes for many years, but that was physical classes. They come over weekends, but now that's not happening. So we are doing online classes. But this education and training is the only way which will help the couples be prepared to face the challenges of postpartum phase. There's a lot more that happens during that phase,
Yeah.
understanding the baby, fighting postpartum blues, postpartum depression, and even small things creates so much of anxiety in the mother. So there's the class is the only solution for them.
Yeah, educating ourselves about what is in store, what can happen.
Yes.
Definitely, it brings down a lot of stress and anxiety from,
Yeah,
our
definitely.
mind.
It is important for them to be prepared for it.
Yeah.
And before preparing, they have to know what is coming their way.
Hmm. Okay, so are you providing on-call consultation for basic issues being faced by such people?
Yes, I am doing online consultations. So anybody willing to reach out to me, they can reach out to me directly, or they can schedule a consultation by calling up my clinic. And from there, they schedule the online consultation, and over Zoom call or over WhatsApp video call, we do consultations, and then we give them a prescription, and we follow it up weekly. So I am doing online consultations, yes.
But if someone has very basic questions, someone just needs some advice with respect to pregnancy, that whether we should go ahead or whether we should not, then in that case, can they reach out to you?
if it is just a small issue which doesn't need a
General
complete
query.
evaluation and
Hmm.
a complete they can share their questions, they can share on the messenger box, they can share on the numbers, and we always address them. I'm very open to it. We always try and answer that questions, and only when I feel that no, this needs consultation and we need to have a question answer and understand the problem deeper, then we go ahead with the consultations. Otherwise the small issues can be discussed.
Hmm. Okay. So, so we talked about pregnancy and also about people who are trying to conceive. Uh, what about people who do not want to go ahead and they are pregnant? They will not do not want to go ahead with the pregnancy because of some situations. So in that case, how easy or difficult would it be to get in touch with a doctor and get the medication, or if needed, DNC done and all? How does that work?
No, definitely. If the couple doesn't want to continue, then termination is the only way out. That they have to reach out to the doctor. Reaching out on online consultation is okay. We can write the prescription for her, but then the most important thing here is to get an ultrasound done before she starts with the process, or she will go ahead. So, getting an ultrasound done is a little challenge here, which
Hmm.
is not very easy, getting an appointment and getting, because only emergency scans are done at this point of time, the routine scans are not taken up. So getting an appointment and getting a scan done will become very difficult, and if the scan is done, then she can go ahead and reach out to the doctor, take a medicine from the hospital, and then go ahead with the process that the consultant will take it up if she's physically there in the hospital. This cannot be done on online. But yes, the first step is the most challenging part, which is ultrasound. So if that is done, then I think the rest can be easily taken care of.
Okay. So, thank you so much about all this, talking to us about all this. It was very, very important. And is there any other advice that you would like to give to our viewers related to health in general or pregnancy during
My
this time?
advice will be yes. My advice to all every viewers and every member and everybody, in fact, is not to stress about coronavirus, not to stress about this whole pandemic thing. This has become a part of life, so just accept it, but do not create so much of anxiety inside you and fear and stress, because that's more harmful to your body. Corona
Hmm.
may not be affecting your body, but the stress every day is having a deeper impact on your body and your mind and your soul. I know you will agree with me, Richa, that the stress
Yes.
is causing so much of disharmony inside a person that we are losing ourselves, so that is more harmful. I would request all of you to please de-stress yourself and come out of this fear and anxiety. And especially for expecting moms, it is even more important for you to come out of stress and anxiety, because the stress will have a deeper impact on your health and the baby's health. So
Hmm.
please, do not allow the stress or anxiety or fear to affect your baby's growth or your mental peace, and your not to give you sleepless nights, because your sleep is very important for the baby and to maintain your BP and your sugar under control. So please keep yourself happy and de-stress yourself by doing yoga, exercise, reading books, and listening to music, movies. Do not watch TV, news छोड़ देना, बाकी सब देख लेना, so do anything but de-stress yourself and be happy.
All right, thank you so much, Dr. Rekha. And yes, you are so right in saying that stress is more harmful for
Yeah,
you than actual corona. So stress will affect you as well as the baby at various level, not just physical, even mental and emotional level. I have seen in my sessions how people have been impacted because their mother was in stress during their pregnancy. And in today's date, they are about 30, 28, 40 years old, but they are suffering from things like
suffering.
depression and anxiety.
Yeah,
So the
it
root,
has a very deeper impact on the emotional level.
Yeah, absolutely. So I think we should do everything to control this stress and anxiety and rest. For the rest of it, I think people, doctors like Rekha are there. They will help you. They will definitely support you. All our healthcare workers, they are there to support all of us in these difficult times. Thank you very much for watching, and thank you, Dr. Rekha, for being here, for answering some of my questions. Is there anything else that you want to say before we wrap up?
I would like to thank you, Richa, for giving me this so much time where I can speak and share my views with all the members and the viewers. And I hope I've added some value to your life and your will help your pregnancy and childbirth. Just wishing you a happy pregnancy, childbirth, and a happy life. Always be happy. Thank you so much, Richa. And if anybody wants to reach out to me, you can always reach out my clinic. It's by name Wellstar Clinic and Diagnostics. You can also see me, reach out to me on my social profiles, Facebook or Messenger, or my page, Wellstar Clinic and Diagnostic. And I also have a group where pregnant moms by Wellstar Clinic, where we keep posting a lot of informations for expecting couples, and they can follow that. And in any way, if I can add some value to your life, I'll be very happy. So I thank all of you, and thank you for your time.
Thank you, Dr. Rekha. Have a good day.
Thank you. You too have a good day, and thank you so very much, Richa. Thank
Welcome.
you.
Okay, so that was Dr. Rekha who joined us to discuss about pregnancy and health related challenges during coronavirus times. It was a fantastic and a really valuable session, and I hope it helped all of you to a large extent. Uh, as far as the fear, stress, and anxiety is concerned, in case you are a pregnant couple or you are planning a baby, and if you are suffering from stress, anxiety, or any kind of fears, please, you are welcome to contact us at MindSpring, because this is what we deal with. We help you overcome your fears, anxieties, and emotional blockages to help you in a very smooth and easy pregnancy. I hope you really like this session, and we will see you once again with another guest on next Sunday in our program, The Center Stage by MindSpring. Until then, please take care of yourselves, stay safe, stay healthy, and stress free. Bye.